Hello friends, in this video I am going to discuss about the investigations and the drugs used in management of COVID-19. So before going to the investigations and treatment of COVID-19, the most important thing is to understand about the phases of this COVID-19. There are three phases in COVID-19. The first 5 days, that is from the first symptom to the 5th day, it is called as viral phase. Then from the 5th day to 10th day, it is called as pulmonary phase. After 10th day, you will call it as inflammatory phase. In viral phase, there will be a multiplication of virus and the antibody start to appear. Here you will get all the clinical symptoms of COVID-19, that is fever, cough, loss of taste, headache, myalgia and all. Now in pulmonary phase, your lung gets involved with the disease because of this antibody reaction with the blood vessels of the lung. The COVID pneumonia starts setting in. Then in the phase 3, your body is experiencing a cytokine storm. So phase 1 will be 80% of the people, disease will be self-limiting with phase 1, and 20% will progress to phase 2, and 5% will progress to phase 3. About 1 to 2% will die out of this disease. Now in phase 1, only test recommended is your RT-PCR, that is the antigen test, detecting the presence of virus in the body just for the confirmation of the disease. Only drug which is recommended here is paracetamol for your fever. Drugs which can be helpful will be vitamin C, zinc and other multivitamin tablets. Role of ivermectin, azithromycin, hydroxychloroquine is under question. Then in the second phase, lung is getting involved in this stage, so we need to do a CT chest to see the chest involvement in case the symptoms persist or the new symptoms appear. The second part of this investigation is the blood investigations. We are futuristically trying to identify whether the patient is going to have this inflammatory phase or not. Tests used here are interleukin 6, ferritin, D-dimer, CRP, CBC and all. The drugs prescribed here in this phase 2, the most important drugs are steroids and blood thinners. Dexamethasone, prednisolone are the commonly used steroids here. If we use steroids in the first phase, it will deteriorate the condition of the patient. And the role of blood thinners in phase 2 is to prevent the phase 3. The blood thinners used here are the anticoagulants and fibrinolytics. In low molecular weight heparin, dabigatran are used. Now in phase 3, the damage is multi-organ. So we will do certain tests specific to that organ and supportive care specific to that organ. Here the role of drugs is minimal. To summarize, there are 3 stages of COVID-19 infection, that is viral phase, pulmonary phase and inflammatory phase. In viral phase, we need to do only RT-PCR and take paracetamol. And in phase 2, the most important tests are CT chest and the blood investigations of inflammatory markers. The 2 important drugs here are steroids and blood thinners. And in phase 3, supportive care is important. Thanks for watching this video.